Guys, imagine washing your face and all of a sudden your face just starts bleeding. You'd probably freak out and call a doctor right away, right? Well, our mouth is no different. Bleeding gums are not okay and should be addressed immediately. Let's talk about it. Hi guys, I'm Christina, I'm a hygienist, and today I want to talk about bleeding gums and how to prevent/treat them and when to get professional help. Now, while there are a few reasons why gums can bleed, including things like trauma, jamming something up into your gums, or even allergic reactions to certain dental materials, one of the main culprits is actually plaque and calculus buildup, which is what I'll be focusing on in this video. So here's the thing, guys. Everyone builds up plaque, and if it's not removed regularly, it starts to irritate the gums, causing them to bleed, which is called gingivitis. Now, if the plaque keeps staying on there, eventually it starts to solidify and turn to calculus, aka tartar in layman's terms, and this calculus actually starts to irritate and destroy the bone. Once we get into the bone, this is called periodontal disease. It's not reversible. So as you can see, the more bone you lose, eventually the more unstable your teeth can become, and they can actually fall out. This is advanced periodontal disease. We don't want to get there. We don't want to lose teeth. There's actually a lot of whole body implications, so we want to try to avoid all that. The good news is if you're in the early stages of gum disease, aka gingivitis, it can be reversed with just a couple of changes to your oral hygiene routine. So number one, if you have swollen and tender or bleeding gums, you want to start with some warm saltwater rinses. So for every 8 ounces of water, you want to add half a teaspoon of table salt, mix it together, and then just use it like a regular mouthwash. If you want, you can make a larger quantity. That way you can just pour it into a bottle and keep it on your counter for later use. I prefer smaller quantities so that I can keep my water, freshly warm, but that's up to you. Now, the best way to prevent plaque buildup is to remove it on a regular basis with proper and consistent brushing and flossing. In terms of the brushing, you want to make sure that your brush bristles are hitting not just your teeth, but actually kind of at an angle in towards your gums or down in towards your gums, depending on where you're brushing, because that's where the plaque builds up mostly, is right along the gum line. Now, if you struggle with plaque removal or you build up plaque really quickly and you use a manual toothbrush, it can be helpful to switch to an electric toothbrush because those are much more powerful and can be more effective at removing plaque. A major benefit to switching to an electric toothbrush is most electric toothbrushes come with a built-in 2-minute timer. One of the issues with people brushing their teeth is they don't brush long enough, so a 2-minute timer helps kind of encourage people to brush for longer. Plus, sometimes it's nice when you get a new toothbrush, just like when you get a new anything, kind of motivates you to brush more frequently. Now, there are a lot of electric toothbrushes out there. The Ollie Smart Clean electric toothbrush is nice because it comes with that built-in 2-minute timer I was talking about, and a variety of different brush heads that are great for sensitive gums. In fact, this brush comes as part of a package called the Ollie Gum Care Kit, which comes with not only the brush, but also some toothpaste and floss, basically everything that you need to get started on taking good care of your teeth. And they even have a money-back guarantee, so if you don't see improvement within a week, you can get your money back. Now, flossing is just as important as brushing, so don't skip out on that. In fact, oftentimes, bleeding gums and gingivitis starts with people not flossing or not doing it correctly. So make sure you're flossing ideally once a day and make sure that you're really wiping down the side of each tooth all the way under the gums to get all that plaque off. Small caveat here, I often get patients who come to me and say, oh no, I don't floss, my gums bleed and they really hurt when I floss, so I just don't do it. The problem is it's not really the flossing that's causing your gums to bleed, it's the plaque that's under there that's irritating the gums, and when you're removing it with floss, it causes bleeding. So think of it sort of like a sliver in your hand. Right? If you don't touch it, technically it doesn't hurt, but as soon as you touch it, it's really painful. And if you try to pick it out, there could be bleeding, but once it's out, your skin can actually heal and feel better. So it's the same thing with plaque. Technically, it doesn't hurt if you're not touching it, but once you do get in there with floss or brushing, it can bleed and be painful. But ultimately, in order for your gums to heal and not be in pain, you have to remove that plaque. If you're really struggling to brush and floss correctly without it being super painful, you may need some professional intervention, which leads to my final point, scheduling regular professional cleanings. Here's the thing, I'm a hygienist and even I miss spots when I'm brushing or flossing, and so I get regular professional cleanings. There's absolutely no shame in it. That's why we created the dental hygiene profession, so that hygienists were trained to go, tooth by tooth, can clean off every little bit of plaque. Now, some people are more prone to plaque buildup than others, but I have yet to meet a single person who has zero buildup, even with excellent home care. So that's why regular professional cleanings are a must, regardless of whether you're experiencing bleeding gums or not. After all, we can't really prevent anything if you don't come in regularly to maintain good oral health. Plus, here's the real kicker. You actually may not experience any bleeding or pain with periodontal disease. There are actually a lot of different factors that come into play. Maybe you're smoking or you take certain medications that hinder bleeding. So the point is, if you want to truly prevent any kind of problems, you should get professional cleanings and checkups on a regular basis. Quick recap. Around 70% of people experience some stage of gum disease. So if you see some blood coming from your gums or your gums are tender, don't freak out. Maybe freak out a little bit, but don't freak out too much. Start with the steps that I just covered, the warm salt water rinses, improving your home care routine, switching to an electric toothbrush like the Ollie Smart Clean could potentially help with better plaque removal. And then of course, making sure to visit your dentist regularly for professional checkups and cleanings. Again, make sure to check out all the links below for additional resources. If you guys have any questions or comments, just leave them below and we'll get back to you as soon as possible. Otherwise, thank you guys so much for watching. We'll see you next time.